Welcome back to me. This is my second time of taking the Ultherapy V contour procedure, and if you have watched my last procedure, it's about getting rid of my double chin. And now here we go again to maintain the Hugis Bigas look with Ultherapy and PDO threads for skin quality. This is gonna be exciting. Don't forget to click the notifications bell and subscribe button to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome Joy Bondoc. Welcome back.
Welcome back to me.
Yeah. So last time we did a V-contour treatment for her. So we did combinations. We had those, remember, PDO threads. We even had like a chin filler and some lipo-dissolving treatments to dissolve the fats. I call them baby fats, right? She looks so young. You're in your early 20s, right?
Yes.
Yeah, still very... And congratulations. She just graduated. Yay! Let's celebrate. Okay, so she has time right now to do treatments like this. She was so busy finishing her course, okay? So this is like a part 2 of what we've done in the past, okay? So how long ago have we done that?
4 months ago po.
Okay, 4 months ago. So actually, when you do a V-contouring, it's not just a single session because you have to do like step-by-step treatment for that one. You consider factors, areas of the face, anatomy of the face. We didn't touch the angle of the mandible, okay? So this part of our face, so it's on the lower third, it's at the back, okay? Now, women nowadays, they want to show the angle of the mandible. Right? So before we were saying like a sharp V, right? It's like really this part here, it's like diagonally slanted, yes, and like nothing here. But right now there's a comeback for women wanting to show the angle here. So when they take a photo selfie, they're showing the angle here. Okay. I'm looking at Miss Joy. Still baby face, okay? So ideally for women, we want like a so-called an oval shape, or like the inverted triangle, or the egg. You know the egg, the inverted egg.
Yes. Well.
So that's the ideal face shape for women, okay? And you're so young, so it's kind of like your face still has much of that round shape, right? You think so?
Yes,
especially
I think so.
This area, right? So
it's very noticeable po kasi.
Right, the mid-face section. So we have kind of like a puffiness in our mid-face area, and then a little bit on the lower cheek area because of the fats that we have there, okay? Of course, we need the tissue fats. The tissue fats, of course, they're attachments between your muscle and your skin layers. So we have the superficial fat. So it's the in-between of your muscle and the skin layer. So it's sandwiched in between the two. And of course, you need some gliding movements in between those tissues. Plus, the fats give volume. They give also contour and shape to the face. We just don't want too much of the fat. So we want to balance it. And we want to do a shaping that's going to be like ideal and balanced and harmonious to your face. And talking about balance, okay? I've also noticed there's an inherent asymmetry on the lower third of your face. So like if you touch the other side, like on your left side, so you touch the bone here, you kind of palpate it, right? And it's kind of outward. But when you palpate or touch the right side, you feel that it's kind of a bit inward. Notice it? So that's why when you're taking a picture on your left, you can see a bit of your angle of the jaw here, but compare it with your right, it's kind of inward. It's hiding. So we want to bring out the right side. We want to do a treatment that will balance the left and the right, and at the same time still improve the shape of your face, still kind of a bit of a V contour, but already showing that angle of the mandible. So what procedure, what treatment, we'll show you when CSA Medical Aesthetics return. And we're back, so we're with Joy, okay? So looking at the face shape again, so we wanted to achieve the feminine shape face, right, Joy? So last time we did some chin filler, anterior projection there, and we did some threads also here. So what we do right now will be improving the vertical dimension, more of the height. So 1:1.6 or 1:2 ratio. So we wanted to improve this part of the face, the lower third, the chin area, okay? So if you do a rickets line, I already did a rickets line a while ago and it was already aligned. So what I'm going to do right now is improve the length. So on the length, I'll just use my dermal filler, hyaluronic filler, okay? So I'll just inject directly into the sulcal symphysis mentae here, okay, onto the bone. There you go, I'm on the bone, and then aspirate, and I can use, like, for example, 0.3, 0.4 to 0.5 of my product. So for now, I'll start with the 0.3, okay? So just a simple technique. This is a needle method here, okay? Now my next will be, for my elongation of the chin, I'll be combining it with a cannula method. So I'll be using this as an entry point and deliver it in the so-called deep sulcus here, or the labiomentalis sulcus. So this is my entry point again here. So I'll just pinch the skin and a tiny prick there. So I have my gauge 22 cannula here. So we'll insert it in that entry point, okay, and glide it towards my labiomentalis crease. Now I do a twisting motion like this while I advance my cannula tip towards this crease, the under lip crease there. So this is a technique to lengthen our chin also, okay? So not injecting on the lower half of your chin via anterior approach, but this one is improving that deep sulcus here. So we're not really eradicating the sulcus, we're just minimizing it, and a little bit on the side here, okay? So just a minimal dose, like you can give 0.3, 0.4, 0.5. At most that I've given is 0.7, okay? Then you can do your 0.3 there, okay? So we'll proceed with improving also the so-called part of the jaw here, the angle, the mandible here, the mandible angle. What I'm gonna do is, for women, when we want to improve this angle here, we inject at the posterior aspect of the angle here, okay? So we have the ramus, we have the body of the mandible, so we go at the back of this angle of the mandible, and then needle method, go at the back, okay, feel for the bone there. So I'm already onto the bone, and what I do, I still aspirate, and then I can like use 0.5 here just to improve that angle there. So we call this like a gunshot method here, like a 0.5. Then I will combine it with my cannula method. So my entry point for cannula method for young ones will be at this part here. When I do it for older patients, I can do an entry point at this part here, middle of the body of the mandible. But this one I'll use as my entry point. Okay, make a puncture there using a gauge 90 needle, and then I can just deliver this like a line towards the jawline there. So this is like making a jawline definition for Joy. You're still okay, Joy?
Yes, Doc.
So we want that kind of semi-sharp, not really that so sharp, or just a well-defined jawline, okay? So just a minimal approach here. Tiny aliquot there of your product, okay? So like a linear retrograde technique. And then you can go to your ramus of the mandible, okay? So for the ramus part there, I want to improve it. Okay, just twist your cannula and go here. So just improving the angle here. Okay. There you go. So we have done this part, the right mandibular angle. Okay. So So what I'm gonna do right now is proceed to the left side. And later on, I'll also be combining this with my Ultherapy to still kind of reduce the fat tissues here to kind of give her that well-contoured face, right? So let's go on. Let's move to the opposite side. On the left side. Now I'll be combining with my Ultherapy. So let's just do some Ulthera shots more on the right side because she has more volume on this side here. How are you feeling, Joy?
Okay lang to.
Okay lang.
Basic.
Yeah, basic. Exactly. So needle method and cannula method using dermal filler hyaluronic substance to elongate the chin, improve the vertical dimension, so more of the length. Then we also did like gonyo filler injection and then the jawline area there. So we want to further improve the shape of the face. We'll be adding Ulthera shots. So apart from Ulthera shots, you can still do like lipolytic injections, mesofat dissolve. You can still do your contour threads, PDO threads to do your reshaping. So we have like combination procedures that we can do, okay? So I love doing combination. It gives that optimal outcome. So this is more of a synergistic effect. So we want to target different tissue areas, different anatomical tissue layers. So I'll work more of this side here. So I'll be delivering like 30 to 40 shots here on this side here. Okay, we'll start now. Okay, so we are on our last 5 shots here. So we are improving the contour and we wanna make the face more feminized, youthful. So we're also in the prejuvenation treatment for Joy. So this is also stimulating collagen formation and it's anti-sagginess, and plus it's gonna lift and tighten the skin of Joy. Okay, so we have done the contouring of the face with our filler plus the Ulthera. We'll show the results to Joy when CSA Medical Aesthetics returns. And we're back, so let's show the result to Joy. So here's our mirror, Joy. Yeah, we did combination like our filler hyaluronic for the chin elongation and also bringing out the angle of the mandible. Plus, we did combine with our Ulthera to kind of like minimize some of the bulging fats in the lower cheek area. How are you, Joy?
Ang ganda po, ma'am. More
So far, so
snatched
good.
and sexy.
There you go. The word snatched and sexy, okay? So it's a matter of like following your ratios and proportions, balancing the face, making it symmetrical, you know, because beauty is balance. Beauty is symmetry or symmetrical. Beauty is within the proportions. If you're out of proportion, no beauty, okay? Because you don't want to naman too much of chin, too much of lips, too much of cheeks.
Yes.
You just want to make everything proportioned. Yeah, the right size, the right shape. There you go. So far, what's the feeling?
Medyo may discomfort lang
Right.
po sa yes, no. Pero,
Exactly. There's like a sensation of heaviness. I had my chin also in the past, like 2 years ago. So like a minimal amount, 0.4, just to improve the anterior projection. So normally it's kind of like there's a heaviness or some kind of, there's something there, but so far you're good, right? Especially we did combinations for her. So we had the needle technique and the cannula method too. So you felt those like the cannula when I was inserting it in the soft tissues. You feel the cannula like manipulating the inside of the skin, right?
Yes.
But so far so good.
So far, so good.
And then what about the Ulthera?
Wala mo po masyadong na-feel, no?
There you go. Because we left a numbing cream for 45 minutes before we did these procedures. Plus, of course, the hyaluronic has lidocaine. Kinda, it numbed already your nerve supply there, your sensory nerve there, okay? So it helped in the procedure, so it's gonna be the comfortable one, okay? Not much of a pain or discomfort. Because the Ulthera will be working for about like 8 weeks to 12 weeks. So it's gradually like reducing some of the fat pads there, but at the same time it's tightening and firming your skin, like your collagen stimulation, elastin stimulation will happen in 8 to 12 weeks time, okay? So that's with the Ulthera. But with the filler, you can see an instant result whenever you do filler, okay? So you notice already there's the elongation of the chin part, and we reduce the deep sulcus there. Plus, I can already see the angle of the mandible, okay? It's a better shape. It's kind of like more of the ideal one for her type of face, for the shape of the face of Miss Joy. Thank you so much, Joy.
Thank you, Doc,
Yeah.
so much.
So we're glad that we have her here, and we're happy for her, okay? And I was also recommending to Joy, like next time, we can like work also on the mid-face section, the nose. Because right now we do so-called nose treatments, just like enhancing. It's not altering your look, but just, you know, it's just like in nose contour makeup when we do these contour lines, right? So we just want to follow those, and then a bit of the tip projection to narrow the sides of the nose. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0917-504-4268 or 0933-860-9193. Joy, do you have a social media they might wanna follow you?
Okay, so I'm Joy, and you can also follow me on Instagram, Joy to Your World, and Facebook page or Facebook, Joy Bondo.
Joy to Your World. That's a good
World.
one. You may wanna like check that out, and if you wanna ask about the treatment and how she is, how's the improvement, how did it change the shape of the face, what's the update, okay? Yun. Follow her po. Okay, so also watch our other videos in our YouTube channel, Contessa Salvador, and do check the previous episode of Joy on the V contour. So this is a part 2 of the treatment. So thank you so much. Thank you, Joy. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.